Welcome back to another episode of Mind, Your Body, and Soul. I am Joseph Ward, and as always, joined by Mr. Mathias Sweet. What's going on, Mathias?
Nothing much, Joe. What's going on?
I'm in here chilling. You got your Walkman headphones on. I
I
see.
know.
Going back in style, and I got my lime green neighborhood
Hater
shades.
blockers on.
Right. Don't hate. Don't hate. If you want you a pair of some neighborhood medical center shades, holla at me. I got you top of the line. You don't need no Gucci, no Louis, and neighborhood.
No Gucci, no Louis, just neighborhood.
Neighborhood.
What colors they come in, Joe?
They come in red, blue, lime green, and we're coming up with magenta soon.
Uh-oh.
Periwinkle and all these different colors.
That's good. So what's been going on for real though? We knee deep 4 months in the new year, in the second time of the second year of the pandemic. It's been a whole year now since everything done happened with the coronavirus. So we back in the trenches again, just getting out and about.
Right. Now it's interesting because we're doing this podcast today, and we're talking about outreach, conducting outreach, because as you led with that, going into the pandemic or during the pandemic, our outreach was stifled.
Very much so.
Basically shut down. So we had to either go viral. I mean, not viral. We either had to go virtual. Hopefully we do go viral, but we had to either go virtual or be stagnant. And I'm glad we went virtual because it helped us move forward, and it helped us continue connecting with people and also connect with newer people rather than be stagnant and sit around and wait on the corona to slow down or humans to stop humaning. So
stop humaning?
That's a new word.
Okay, making up new words. I see you.
Right. Now, before we get too deep, do make sure we do our cleaning and let people know that, of course, Mind Your Body and Soul. This is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may or may not have access to. We seek to inform, uplift, empower, and mobilize our listeners to become the healthiest versions of themselves. And our home website is www.neighborhoodmedicalcenter.org. Our podcast website is www.nmcpodcast.com. Make sure you visit both websites. Also, quick announcement: if you want the corona vaccine and you haven't had a chance to get the vaccine, you can visit our Neighborhood Medical Center website. And on the website, on the first page of the website, there's a purple tab that will allow you to sign up to take the coronavirus vaccine. Do it. It's free, and get what you want. Also, make sure you subscribe to our Neighborhood Medical Center YouTube channel. Subscribe to the channel and tell somebody else about it. The videos, like, comment, and share. Make sure of that. And if you are a person who catches the podcast on the go, YouTube may not be your thing. Remember, you can go to our website, or you can go to anchor.fm. Search for Neighborhood Medical Center. We also Breaker, Radio Public, Pocket Cast, Spotify, and Google Podcasts. So check us out. We out here a little bit. We out here.
We trying.
We trying to be. So we're constructing this conversation around the importance and power of outreach. You and I both, we've been working in the field of public health via outreach for over 12 years. So I want to start with asking you, before you got into public health, before you got into HIV/AIDS, when somebody first presented the idea of outreach to you, what was your initial thoughts about conducting outreach?
I was like, I don't know if it's gonna work. It's just like you look at it and be like, you can't talk to people. People gonna do what they want to do. People gonna say what they want to say. And when you go out there, and I was like, I don't know, because I never really paid attention to like what people said in the community or when things happen. The only way I really found out was like watching the news on what happened. Then I want to get serious about something. So that was like my first initial like thing to it. I was like, man, I don't know if this is gonna work. People say it works. It don't work. people do health fairs. I figured, oh, you go out to the health fair, you ain't getting nothing but the goodies off the table. And
Right.
you know what I'm saying? That's what a lot of people, think outreach is. You just go set up a table and you get the goodies or the little promotional items off the table, like them glasses you rocking right now.
Right.
But it's a lot deeper than that. Once I got into the public health field and realized it's a very big, it's one of the major keys to today's healthcare. You know what I'm saying? Facilities. That is one of the biggest key components to any health center, to any community event, is to have educators and people to go out and do outreach. That is the main. It's one of the biggest jobs out there. It seems like a small job, but it's one of the biggest ones that's out there.
Yeah.
But what about you?
I really had no idea really what outreach really was. So I was making it up in my mind, just trying to, all right, this is what it's going to be. Um, and then I had some similar thoughts. Are people really going to listen to me? Like,
Mm-hmm.
why would people care? Okay, we go in like we do now. We go into one of these housing projects. You go into 11 to 12 in the day, and people are in their own environment, in their own element, doing what they do. I come in and I'm attempting to give you information about something that you may or may not care about. So
Right.
I'm not gonna lie. In the beginning, I was a little intimidated because I was like, I don't think people are going to care. I don't think people are going to listen. But over the years, I've learned it's kind of like marketing and selling. So like my whoever your favorite artist is, like if you have a favorite painter or favorite singer, or favorite rapper, once you build trust and a rapport in that particular person, then what they're selling you or what the information they're giving you, if you are into that person or you bought into what that person is giving or you trust this person, you're going to listen to what they're saying.
You right.
And so that's one thing that in the beginning I wish I would have understood is you have to build rapport with people
Yeah.
because like you say, outreach, a lot of people don't understand, but outreach is the backbone for a lot of these healthcare facilities because that's this when you talk about meeting people where they are and reaching people, this is
Mm-hmm.
where you meet people where they are and reach people. That's what I think.
I mean, but you're right though. You know what I'm saying? Like even going back to, back in the day when you're looking at stuff and you're saying you try to figure out what you want to be when you grow up and do everything. And a lot of people don't understand that you can get a degree and be a nurse. You can get a degree and be a healthcare manager. You can get a degree and be political science. You can do that, but you can still do outreach. You can
Yeah,
do a lot of things with outreach because it's about educating the community. And if you look at the community always has those gatekeepers.
yeah,
And that's what you tend to try to become when you're an outreach person or an
yeah,
outreach worker or a healthcare or a health educator, because you want the community to buy into what you're saying because you're trying to bring your knowledge and your awareness of certain things to the community. And you need that help and buy-in from people. So if you go and like Joe and I know, anytime we go in the community, we got our hood nicknames, we got our nicknames. They already know who we is and who we are and everything like that. So it's like they be like, oh, here they come. Y'all better listen to these boys. They know what they talking about. So that
right.
gets the buy-in from the other people. So it's just about reach one, teach one. It's basically going back to the old school roots. Is we got to hit that pavement running. And a lot of people who get in outreach don't understand that. You got to put in the time, the effort, and you got to
Yeah,
have the will and the want to really go out and educate people. You got to have that drive and passion. It's not about the money. It's not about any of that. Some days we out on the weekends and it's like, you know what?
it is
We
what.
here.
Yeah,
And you know what I'm saying? It's not about that. It's about you got to get the satisfaction to be out there to say, you know what? I'm here to educate somebody and I can save somebody's life or I can teach somebody something. That is the most rewardingest part for me for outreach is when people come back and say, you know what? You really helped me. You really saved me or you really taught me something. And I always think about this now. So those are like, you know what I'm saying? Like those are the key points of outreach is making sure you can make a difference in the community. And when you feel that, it's you doing your job.
right. I totally agree. Totally agree because to me, breaking barriers is one word,
Hmm.
a phrase, or whatever that come to mind when we're talking about outreach. Is breaking barriers, like you said. We don't want anybody to get a misconception about. what outreach is, how to conduct outreach, all these different things, because it's work, it's a process. It's building relationships. And if you're not in the business of building relationships, outreach isn't for the person who's not a people person.
Mm-hmm.
You're going to do more harm than good if you're not a people person, because you're like, okay, I'm just doing this because it's this job. And you come across somebody who they may be disgruntled, but they looking for help. So they're disgruntled, you're disgruntled, y'all about to have a clash. And you can't operate like that. So um, it really is a process. This really is something where every day you have to go out and you have to continue to build the relationship. You have to be seen, like you say. In order for you to get a nickname in a lot of these neighborhoods that we work in, you got to be there.
Mm-hmm.
They have to see you enough. So we're talking about a presence, daily, weekly presence in these neighborhoods, and you're not just there, because it's like you have certain entities who will be in these communities, and people like, okay, they're over there, we're over here. Then you have certain entities that are integrated with the people in the communities. Like, you can't be afraid to talk to people.
Mm-hmm.
And that's one thing I used to tell people from the beginning. Like we were asked when we was doing our trainings is, you're not afraid of people, are you?
Right. Cause like today, Joe, I was, we always pushing the COVID-19 vaccination. And the girl was sitting in the lobby, and I was like, "Hey, you want to get a COVID shot?" And she was like, "You the guy to drive that nice little blue car, ain't you?" I was like, "Yeah." So it's like, yeah. She's like, "Okay, well, I'll take it. Come on, because you know talk me into it." But it's just about having that presence so they can see, okay, well, these people are really out here for me. They're not, because a lot of people get outreach twisted because there's a lot of people out there doing the wrong type of outreach. And when I say the wrong type of outreach, is they go out there and collect data for grants and stuff like that, get the people buy-in, they get their data, and then they're gone.
Right.
And that affects the people who are out there doing the work the hardest, because we're out here, we're hitting the pavement, we're doing this. You come in to get grant stuff, and then boom, you're gone. And then you don't come back again for another 4 years trying to collect more data. That just affects us because we're out here pushing, pushing, pushing. And it puts a bad name on us because people think we're out here just to get data or to utilize them for statistics and things like that, but that's not the case. Me and Joe's goal is to bring people education about health, to make them the healthiest person they can be. You know what I'm saying? This ain't just the overall healthiest podcast. We want the community to be the healthiest person they could be. It doesn't matter if you're black, white, Asian, Hispanic, mixed like myself, different persuasions, different ethnicities. We want everybody to be healthy and be able to live normal, healthy, long lives. We don't want people our age dying or
Right.
younger. You know what I'm saying? We want everybody to live a full life. And that's what outreach does to us. Like, outreach is the initial person for, I can only speak about neighborhood. I don't know how other people do their outreach programs, but neighborhood medical center, our outreach person is the number one person they see first before they have any interaction with the clinic. And if our interaction isn't great, and we don't have that charismatic attitude, that warm, inviting spirit, you might not want to come to neighborhood.
Right.
And that's where it goes. And it trickles in from the people who are out there. Outreach workers are people who go out and get people to get in care. And
Right.
that's what a lot of people don't understand about that. Our job is to get the people what they need. We are the community resource for the community. We need to know everything we can know or find out easily about what these people need in the community. And if we can't do that, then we can't be a healthcare outreach worker.
You can't.
So we can't get the education, we can't do the things like that if we can't reach the people and have the resources for them. Joe and I are the main two resources here in Leon County that can get you whatever you need, from housing to healthcare to food to, I mean, just anything you can imagine. If we
Yes.
don't know how to do it, we'll find a resource to figure out what we can do to get you there.
Right. But that goes. It's like you in my head, right? So there's a right and a wrong way to do outreach, but
Mm-hmm.
the way you conduct outreach is always relative to the population that you're serving.
Mm-hmm.
And so some people may say, well, there is no wrong way to do outreach, but yes, there is,
Mm-hmm.
because it's like one of the sayings. The road to hell is paved with good intentions.
Mm-hmm.
So you could mean well, but the manner in which you go about conducting this outreach could be detrimental to the people that you're helping. It could help you and your specific purpose, but it could be detrimental to the people that you're serving. So it's like I had to check my ego and stuff like early in the game because it's like I used to get mad that people didn't care about HIV as much as I did. Then I realized, well, they don't have to. I signed up to do this. Now, what I, one thing, and so I was at a crossroad. I could either continue being mad that people don't care about HIV the way I do, or I can seek further understanding from the people that I'm serving to figure
Mm-hmm.
out how I can better communicate my messages. And then once I put my ego aside and I sought more understanding, then that's when I realized that HIV/AIDS, because the way my life is set up, and because this is the occupation that I chose, it's a higher priority in my life.
Mm-hmm.
But for somebody who is maybe in survival mode or some other factors that are going on in their life, like if I'm worried about paying my light bill, I'm worried about my kids eating, I'm worried about having a roof over my head, I'm worried about other things. Protecting myself from HIV not gonna be the highest priority on my list. All right.
You're right.
So as an outreach worker, when I come across this person, I'm fully understanding, like you just said, we need to be resourceful. As an outreach, as a person conducting outreach and education, you need to be resourceful. Why? Because I can help you with outreach, but I also need to be able to help you with all the other issues that you have. Because HIV can be something that's taken care of, or the prevention of it, when all these other things are taken care of. Like I can't want that to be a priority in your life. That's not my job to force that into your life. My job is to seek understanding. And once I seek understanding, then I go by the best course of action to help this person help themselves. But the main thing is understanding. And that's why I say there's a right and a wrong way, because I can it's like think about the person that comes into your community. I don't know you. This is my first time in your community, but I have the urge to help people because we always got people. I want to help change the world, right? But you come in with preconceived notions of what you think these people need to help change the world, and you haven't taken the time to get to know the people. What are we doing? You're
Mm-hmm.
not going to help those people, and those people are not going to allow you to help them because you're not even trying to get to know me.
You're right. You're right.
And so those are things that people need to really take into consideration when we're talking about outreach, and that's why we want to cover this in this podcast. Is yes, we do a lot of things here in the public health realm and here at Neighborhood Medical Center, but I know like in conducting outreach, you have to be serious about it. You have to be intentional about it. You have to be strategic about it. You have to be understanding. There's a lot that goes into it. There's a lot of planning because it's kind of like it's even like if you're an athlete or something, you spend the whole week training. You spend 3 hours a day for 7 days training just for 30-minute competition. So it's kind of like that. We're going to spend most of our time learning, and yes, we're going to conduct outreach, but we're going to spend all this time learning and preparing ourselves. So when we conduct it, we can make the greatest impact in the amount of time that we have.
You're right.
So I want now asking you, what are some of your most favorite outreach events that we've conducted over the last 3 or 4 years?
Hmm. Well, some of my what I like about neighborhoods outreach department is that we are able to think outside the box. And I think that's what we have to do. And one of my favorite things that we do is we get to adapt to the populations that we serve. And that's a big thing with outreach is adapting to those populations. So we've done everything. I think my favorite one is our drag show that we do every
That's why I
year
said what I said because I want you to talk about it.
because it's something that's different. So for September, every year for National Gay Men's HIV/AIDS Awareness Day, we do a whole weekend of events. So we target each different type of population. So it's not just targeting LGBTQ. We're targeting everybody. It could be non-binary, binary. It could be cisgender. We don't care. We're just trying to get people to education. And with that, but we do something that's going to bring people out. And that's what you have to think about when you do targeted outreaches. How you're going to captivate your audience so you can keep them there and give them the education, but giving them the same fun and excitement that they're looking for. And I think neighborhood has really gotten that niche in having these type of events. But yeah, we're doing an event that's fun and stuff like that, but you're getting your education as well as you're getting the fun. So like for the first night, we'll do a educational talk, and I love the first night because you get to hear somebody who's powerful, who's been through there, someone who was diagnosed with HIV, and they tell their story. Like to me, that is the most powerfulest thing that you can ever do is to hear a person's story on how they contracted. Because if you listen to different people's stories, they're never the same. They never just say, "Oh, I woke up, I slept with this person, and this is what happened." Da da da. The stories are the same. You get it's almost like a telenovela, like a soap opera sometimes, because you never know how it's going to turn to where it's going to be, or your assumption might be the wrong thing. You thinking it's going this way, but then it goes left and give you another thing. So it gives you something to think about, the different scenarios on how to educate people, because you never know what someone's going through or what people have been through in their life, and what they're going through somebody else could be going through, and it kind of helps them. To me, I feel that's the best type of outreach as well, is getting people who have been through those same things. Me and Joe can never tell somebody what it's like to be HIV positive. We can't, but we can empathize with you. We have the empathy for you, but we can never tell you, I've been through that. Now we can tell you that we've been through STD testing. We done those type of things, and got STD tested, and we've been through the clinic side of things, but we never been actually on the other side to where we have to say, hey, I do apologize. We're going to have a different conversation today. We have had those conversations. It's just we can never be in your shoes at that point in time. So I really like the fact that we bring somebody in who has been in your shoes and be able to express and get their, their buy-in, because it's someone who's like you. Just like when you do events and things like that, you're looking around and seeing, well, what does this person know? Do they look like me? Do they act like me? Are they the same type of person as me? But the thing is, we might look like each other, we might this, but I don't know what you're going through.
One of the best examples was the last weekend that we had, the first day, Lathia.
Yes, that's the one I'm referring to.
So we're talking about a black woman who's a CEO of a Fortune 500 company. She's a regular person who, despite what some of the narratives may be, she was within a relationship, in the confines of a relationship. She didn't step out. The partner did, and that's how the transmission happened. But she's a regular person who's positive, but still living a regular life and thriving. And it was cool after we did that night to see her in the different commercials and stuff. Because I was like, hey, she in the commercial with the dude from Remember the Titans.
Mm-hmm.
So yeah, that's cool. So that first night set the tone.
It did. Not only did we set the tone with that, but we also had a little food. A little food gets everybody involved. But it wasn't even about the food. It was just about the atmosphere, the vibe, because you got to see somebody that looked normal. And when she walked into a room, she didn't walk into the room like she was HIV positive. She didn't walk into the room like she was, oh, I'm sick, I'm dying, I'm this, I'm that. Like most people think, oh, if I get this disease, I'm going to be sick, I'm going to be falling over. She walked in, blended right in, was like, hey, I didn't even know who she was until she said, hi, oh, I'm your guest speaker for today. And I was like, oh, really? Oh, thanks. You know what I'm saying? So it's just like, those are the things that you watch. When she walked to the room, she commanded attention. She was there. She was amazing. And her story was amazing. And when the pandemic's over, she is coming back. so you can get a chance to hear and pick her brain, because she does a lot more than just tell her story. Her story is powerful. I mean, just the experiences she's been through is just powerful and just amazing, as well as a lot of the other speakers that we come from. And that's what we, you know what I'm saying, we really do embrace people to get strong, to tell their stories, to tell that what happened to them, so we can try to educate people and bring awareness to what's going on, so we can try to limit this actual disease for people contracting it. Right. Then that second night, we get a little bit of fun. We have our annual drag show. And that annual drag show is anywhere about 15 to 20 entertainers. They come out, they do their show, but the best part about it is we call it prep first. Mm-hmm. Because we want to make sure that you prep first. So prep, pre-exposure prophylaxis. And that's the HIV medication that prevents you from getting HIV. And we really want people to understand, hey, there's a method out here to help us prevent you from getting HIV. So we give a big spiel about HIV prevention with PrEP and PEP. We have the drug reps come in and they do presentations about it. You know what I'm saying? Just fun ways to get people there, because you think you're coming to a drag show, but then throughout the drag show, you're getting information about PEP and PrEP. You're getting the education that we want you to get that's going to stick with you, because you're going to remember, you know what, we talked about that PrEP first. And then they were like, oh, well, what's PrEP? Oh, let me tell you what PrEP is. Right. And then that last day, I think, is one of the most powerfulest days ever. And a lot of people might feel some type of way about this type of event, but it's a gospel drag brunch, because we felt like we needed to do something, because a lot of the LGBTQ population is kind of vulnerable, and they really don't feel comfortable sometimes going to church. They don't, you know what I'm saying, or they get ostracized. Not every church. I want that disclaimer out there. We're not saying that churches are bashing people or doing anything like that, but it's just from people's personal experiences and people's, you know what I'm saying, personal views and feelings about things. So it's not saying we're not bashing the church, we're not doing any of that. Right. But it's just a way for us to give back to that community. And they come in, they do drag numbers to gospel songs. That was like one of the most powerfulest days ever, because I mean, people were really, you felt like there was a presence and a spirit there that was uplifting people. Just hearing the host talk about her experience with the church and how all the things happened and how she reacted to those things and just still kept the uplifted beat. So it's our events are not to down people or anything like that. Our events are to uplift and build people to be better people. And I really felt like that event right there really helped the LGBTQ population to build and be a stronger community and have a stronger presence, as well as it did with the heterosexual population, because it was a mixed crowd. It wasn't just LGBTQ. Right. It was a mixture, and people were like oohing and ahhing. Like the people were coming in from the hotel, just following in, because they were trying to figure out what was going on upstairs, and just the whole presence. So I mean, to me, I think that was the best one that we had. Yeah, it was one of our major events. Yeah. But the other event that I would say is more powerful and speaks to us would be when we go on college campuses like FAMU and TCC and FSU, because we really get to meet a lot of these young kids. And Joe, I think that's part of the thing that I love most about my job, is just the educating the kids, because back in the day, we always got the whole thing where sex was taboo to talk about. We don't say it, you do it. Trash. Huh? Our sexual education classes were trash. Right. They just tell you what most parents tell you. Don't have sex, don't bring no babies home, da 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 da. How you do that? How you do that? And then in school they gave you the egg or a bag of flour to take care of, and you had to take care of it through the weekend. Yeah, but see, now my favorite part of outreach is the education. I love to go, and whether like I was just telling somebody this the other day, like I don't care where we do the classes. I've done classes in lunchrooms, down the hallway from the bathroom, all the way almost in the bathroom, in the cafe, or not the cafeteria, but in the auditorium, in classrooms, outside. Shoot, we've taught classes in vehicles. Wherever I need to teach it, I teach it. But I love to see people's light switch come on.
when they get it. Like, you're out in the community and you're talking to somebody, and in their mind, well, you can't catch an STD in your mouth, and then you not only tell them that you can catch an STD in the mouth, but you show them how it happens, and then the light switch comes on. Like we've said this before, like the young man who his whole thing was, I only use magnums because we only supposed to use magnums. But then we introduced him to different condoms, namely the non-latex lifestyle, and when he used it, his mind was blown. And then when we had other young men who was coming up and was saying, "Man, I'm not using that condom because it doesn't have the brand name that Magnum has." So we had this other young man who was around that age, probably got some respect from them, and he's telling them the same thing we telling them, and the other young men looking at him like, "You for real?" Then he tells them that his experience. Now, oh man, yeah, let me try them, and it's powerful because another thing too about doing outreach and out here and helping people is you got to learn how to take your butt off your shoulders sometimes, right? Because you may be great at delivering a message, but you may not be the best person to give this message to this specific group of people. So how you can make yourself handy is teach others. And I go back to what you was talking about earlier, going into the community. One of the most powerful things we did was started educating gatekeepers. Find you the gatekeepers, educate the gatekeepers. Like we have women who work the streets who pass out condoms for us, and when they see us, they stop us. Hey, I need some more condoms to pass out. Then kind of find out when you talk to the men or other people in the neighborhood, they're like, "Hey, I know y'all need to get some more condoms." And we're like, "Oh wow, this is really working." So it's getting into the neighborhoods and the communities, finding out and understanding how the community works, the breakdown, and how things flow, what people do this and what people do that. When you start to understand that will make you more of a powerful asset versus from the outside looking in, and I'm just going to force my way into your community, and I want to force my ideas and my information on you. We seen it at a outreach event not too long ago. It was okay. We still have to understand timing and understand the culture of the people that you serve. Certain communities don't wake up till a certain time. So yes, we start work at 8:39. All right, cool. That's when we start work. But the communities that we serve and that we mostly want to serve, you need to go there in the afternoon. You need to go around 1 or 2. What time do the kids get out of school? Because guess what? By the time the kids get out of school, the whole neighborhood is on. It's up, lit. It's out there. It's doing this thing.
And see, Joe, that's one thing that people don't understand. Outreach isn't an 8 to 5 job. It isn't. Like Joe will tell you, our phones ring constantly. They're not just it's 5 o'clock, my phone goes off. No, it's 5 o'clock, my phone's starting to ring. It's
Right.
somebody's having an emergency at that end of the day. And I get that sometimes people say their emergency ain't my emergency. I get it. But at the end of the day, when you out there and you've been working hard to bring a certain person in or to bring people into from the community, it's your business that I don't care if it's 9, 10 o'clock at night or on the weekend. My phone's ringing, I'm answering it 9 times out of 10 if I'm around it or if I'm by it or if I see a person's number. I was like, let me answer this, make sure they're okay. Because you never know. It could be that one person that you're stopping from doing something, or could be that one person that's needing you for backup to say, hey, I feel like I need to, saying, because we do get people who do substance abuse and things like that. Hey, I think I'm finna use. No, I just need to tell you no. Okay, I just need you to hear tell me no, I don't need to. You know what I'm saying? So those are the things you never know what somebody's going through. And that phone call could be a saving grace for that person. So, you know what I'm saying? Don't always, I know people get busy, people get tired and don't want to answer the phones and want to ignore people. But sometimes that one little time could be a time you shouldn't ignore that person. So that's how we look at it because our job never stops. I might get a call at 7 o'clock in the morning. I might get one at 9 p.m. tonight. But I'm still going to answer that phone and tell you I'll talk to you in the morning about it.
Right. Yeah. I mean, but that's real. Um, it's a like you say, it's a continuous thing because it's like when I was at the health department and we did the into the night outreach, or
Mm-hmm.
when we will go out and do outreach at specific clubs.
Mm-hmm. I enjoy those. Those were fun.
Right, but also with the full understanding that this type of outreach, I'm reaching a different population.
Mm-hmm.
So I'm not going to dress the same. The way I'm going to dress when I go into a classroom is going to be different from when I go to a club or we doing outreach in the street late at night. Because between all right, between 9 a.m. and 5 p.m. that's one population.
Mm-hmm.
Between 5 and 9 is another population. Between 9 and 12 is another population. Between 12 and 5 is another population. Between 5 and 9 is another population. You're getting different groups of people. You got 24 hours broken up like that. You're getting different people from different walks of life who are existing at different times, different points of periods. And but you have to be into the community to know that. You got to be into the community to understand that. Once, like we talked about, making yourself resourceful. So that's a whole nother aspect of an outreach work. First of all, you need to be able to connect with different people on different levels. How human are you? How well are you at building and maintaining relationships? So if I like we talked about, if I have a client, like we had a client who, or a patient rather, who needed help with light bill. He's like, all right, the stimulus check came. The stimulus check allowed me to pay my last 2 months of rent. But after this next month coming up, I'm not gonna have rent, and I need help to get my rent. Now, we don't like my job description doesn't say help people find their rent, but I know a part of HIV and HIV outreach is for some people, if they can't pay their rent with the regular money that they have, a lot of people are going to find a way to pay it. And sometimes that goes into using what you have to get what you need. And
Mm-hmm.
we don't want a lot of people doing that because that could lead to more risky behavior, which could make it more susceptible for that person to contract HIV. So we're going to make sure that we uh, align ourselves with different agencies that will help this person help themselves. Like our Healthy Happy Hour. Go check out our Healthy Happy Hour. We just interviewed Miss Tiffany Hill for the Vet Center. Before that, we did the Capital Area Community Action Agency. So we're doing agencies like that, so you would know if I'm a veteran and I need help, I know I can go to the vet center. But hey, if I'm not a veteran and I need help, where can I go? Capital Area Community Actions Center, right? Or hey, I need job skills, Career Source. Go holler at my man Vincent Palmer at Career Source. And so, like when we first learned about this, it's the difference between um, referring somebody to care and linking them. So
Mm-hmm.
you
So
need
what's the
help.
difference, Joe? Break it down.
All right.
What's the difference?
So referring somebody to care is I can say, hey, you need a job, go to Career Source, sir. Go to Career Source. Just go there. That's a referral. I'm referring you to this organization. Now, I mean, excuse me, that's a yeah, I'm sorry, that's a referral. That's a referral. So refer that
Mm-hmm.
person there. Go to Career Source. Now, me linking you is the person telling me what they need, and I say, okay, well, I know this person at this organization. Matter of fact, let me call on the phone. Hey, Mr. Vincent Palmer. Yes, I have this person right here who needs such and such and such and such and such. Here, they would like to talk to you. Bam. Give them the phone, let those people talk. It's that medium to connect people together. Because I can we know we have certain people in our population, certain people that we serve who they're not self-starters like that. So sometimes you got to give people an extra push. Now it's not my job to hold your hand through the process. Sometimes I got to give you an extra push. But for a lot of people, what works well is whoever your connection is, calling up that connection or taking that person there and having them to connect. That's how you link people to care. So I mean, we do it all the time now in doing our outreach when people need appointments or people don't have primary care physicians. One of the things we do is we make sure we bring our laptops and our technology with us So if somebody, or if we don't have it, we call somebody on the phone, hey, such and such. This person would like to set an appointment. Here, talk to them. That's
Mm-hmm.
linkage to care. That's an important part of outreach. You can't link people to care. You're missing an important component. Point blank.
You're
Period.
right. You're right. But people don't understand that part of the outreach. I think it is, and that's the main part, is that people don't understand that this is what we have to do, and this is what we're about to do, and you know, what I'm saying, going about doing everything we can to really help everybody, and it's going above and beyond. Sometimes it seems like, why y'all take y'all time to do all that? That person ain't gonna care. That person ain't gonna this, but they might not care at that time, and I do whatever I need to do to help them, but they're going to remember who helped them in the end, and then they're going to come back. And that's how you get those patients to be loyal. They be like, how can you get them to do whatever you need them to do? Because I didn't give up on them. I didn't treat them differently. I treated them like I wanted to be treated. And that's what a lot of people go through who are out here in the community, is because they don't know what is, you know what I'm saying, what's what, who to trust, who not to trust. And we got to be there for the people, like, because at the end of the day, if you trust somebody and somebody's out there to help them, and you feel like they're in your best interest, you're going to give them their loyalty. You're going to be there. You're going to do what they ask you to do, as long as they feel like you're helping them.
Yep.
And that's what it's about. It's helping people, and not just worried about what's the next check coming from or anything like that. It's about making sure that we can actually help them.
Right. Yeah. I mean, there's no sense of creating the momentum if you're not going to follow through.
You
So
right. You right.
it goes back to, and it bothers me too.
Mm-hmm.
The once a year health fairs. If you're not going to be consistent in people's communities, don't come at all. And I say that as a person who grew up in communities where we didn't have a lot. I know we went through some hardships growing up, and we needed extra assistance in things. We had people who were there consistently, and we had people we saw during holidays or special time during that year. That don't help. That doesn't help. That you show up and you give me groceries once. Now, because it go back to the analogy of whether I give you a fish or I teach you to fish.
Mm-hmm.
You know, like, so what we do is we've compiled a list of different food banks here in town, in the area. So I don't want you to just have food once. So I'm giving you this literal list that we put together, that we printed out, easy list, the name of the agency, the address, the phone number, and the email, and the name of somebody you need to talk to. This is where you can go for this food bank for this day. This is where you can go for this food bank this day, this day, this day, this day, this day. That's empowering people. The one, the one-offs don't empower people, but doing it on a consistent basis, that's how you really get people to start to see themselves different, and believe in themselves more, because they have to help, and you are helping them help themselves.
Okay. Okay.
So go
So,
ahead.
what would you tell a person, Joe, who's just thinking about getting into doing education and outreach? What would you tell a person who's thinking about going into?
Um, I would say you need to start shadowing somebody within a certain area or population that you want to serve. Because, and I say that because the way we conduct outreach here in Tallahassee, I can't take all of the principles and all of the things that we do in Tallahassee and take it to Dade County and just expect it to be successful.
Right.
The dynamic and the makeup culture, all those things are different. So I would say, if you have the idea or the ambition to do it, find a shadow. Find someplace where you can shadow somebody. Find a mentor. Find a mentor and somebody you can shadow within these areas, so they can teach you how to interact with the people. But also go and interact with the people. Like, one of the most powerful things we've ever done is just went up to someone and just hung out. We set up a table. Because the premise is, we'll set up a table, we'll put some stuff on it. Yeah, but we're really hanging out with the people. We're getting to know the people. The people are getting used to us. Get into these environments, get to know these people, but get you a mentor and study, 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 study. Don't study to be smarter than everybody else. You study to understand the people that you serve. Listen to the people. When they're talking to you, listen to them. Don't listen to respond, listen to understand.
You're right.
And I think if somebody take those 3 steps and continue to keep an open mind, you're not going to be good at outreach if you don't like people. You're not going to be good at outreach if you're closed minded. You're not going to be good at outreach if you only want to serve one population. You're going to be good at outreach the more human you are and the more willing you are to learn. Like, you need to be an empty cup. You can come in with all your degrees and all your experience, but you need to be willing to put that to the side, take your ego down, and learn. If you do that, you'll be great.
You're right. You're right.
Any closing remarks before we close this down for the day? Because we want to hit y'all with this podcast because we back. We still doing it, but life has been happening, and we've been trying to make sure people have the resources they need. But we back, and we got a series of good stuff coming up. But any parting shots you want to give the people?
Just know that if you do, what I'm saying, want to get into outreach or want to volunteer in outreach and things like that, just reach out to your local health clinics and see what's available for them, because that's the best way to do it, is to see what's going on. Look at your campuses. Come up with ideas. Don't be afraid. Don't think inside of a box and think we just have to have a health fair, or we just have to do this. Let's do a targeted outreach event. Do something that's going to get the people there. And then once you get them there, you have that captive audience. So we just want you to understand, to do an event, have that captive audience, but hit them with the education. Hit them with the left, the right, from the front and the back. But make sure you hit them with the education while they're there. So guess what? You had an accessible event. Yeah, you had a lot of people there, but you also give them the education. And don't think that because they're not paying attention that they're not listening. They listening. They listening probably harder than what you think they're listening to. So just make sure that you think outside the box and do something different. Don't just do the regular health fair where you sit at a table and encourage people to come by each table and talk to the people. Do something fun. Do something innovative. Something that's going to capture the audience, and then hit them with the education while you're doing it. So, I mean, that's my only pointers out there. If y'all want to talk to me and Joe about more about outreach and education, feel free to hit us up. We here all the time. If you want to partner with us with Neighborhood Medical Center, we're more than welcome to partner with anybody who's trying to do an event in the community in the Leon and surrounding counties. Just hit us up. We here. I mean, like I say, we walk with the commercial sex workers. We do church events. We do LGBTQ events. We do heterosexual events. Anything that's out there where we can educate people and bring people to healthcare, me and Joe are down for it. So if you want to do an event and collaborate with us, give us a call. Shout us out on Facebook. Shout us out on YouTube. Instagram is coming. We're working on that now. But you can hit us up, and we'll be more than willing to talk to you and put our heads together and come up with some events and things that we can do in the community. So let's just get together and have a big session to where we can educate our community, because that's what we're about. It's time. Coronavirus is passing. It's still not over, but we need to be able to make sure that we can educate people safely and smartly, but still educate people and bring people into healthcare.
Yeah, and I'll say this. Outreach isn't about, because you made me think of this when you said a certain thing. Outreach isn't about how many people show up. It's not about how many pictures are taken. It's not how many public appearances. Outreach is about the impact that you're able to make on people, like the real practical impact that you're able to make on people. We want to make sure people don't get it confused with, hey, just because you see me, that means I'm doing a good job. It's about the impact that you're making on the people at the end of the day. And if the impact isn't being made, yeah, you were there, but did you help? Because remember, at the end of the day, if it's not getting better, then we need to go back to the drawing boards to make sure we're making it. So you can contact me, J Ward, at neighborhoodmedicalcenter.org. You can contact him, Mathias, at msweet at neighborhoodmedicalcenter.org. Remember, our parent website is www.neighborhoodmedicalcenter.org. Our podcast Website is www.nmcpodcast.com. Check us out on Facebook. Like our Neighborhood Medical Center Facebook page. Subscribe to our Neighborhood Medical Center YouTube channel. That way you can get all of these Mind, Your Body, and Soul podcasts as well as our Healthy Happy Hours. And remember, we're also on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts. So we're out here and we're going to continue to drop these podcasts on y'all because we're doing our best to make a difference. And you can get yourself, see this the Blue Pill Neighborhood Medical Center shade. You can get the greens, the blues and the greens. So, this is how we doing. We cool. I'm in the show with these. I'm in the show with the blues. So we real cool. And I think I feel like I look like Flavor Flav, but it's all good.
Flavor Flav.
Hey, so I'm Joseph Ward, he's Mathias Sweet, man. Y'all mind, your body, and soul. Peace.
Deuces, y'all. Have a good day.